If you're dealing with occasional constipation, milk of magnesia suspension may be able to help. It's a type of laxative that works by drawing water into the intestines, which helps to get things moving. But that's not all, it can also treat symptoms caused by too much stomach acid, like heartburn, upset stomach, and indigestion. So if you're looking for relief from these issues, milk of magnesia suspension might be worth considering. When it comes to dosage, make sure to follow the instructions on the label and talk to your doctor if you have any concerns. And as for timing, it's typically best to take it on an empty stomach, at least 1 hour before or 2 hours after a meal. So keep that in mind when you're planning out your day. To take milk of magnesia suspension, simply follow the directions on the product label or as directed by your doctor. If you're using the chewable form, make sure to chew thoroughly before swallowing. For the liquid form, be sure to shake the bottle well before each dose. It's important to measure the dose carefully using a special measuring device or spoon to ensure you get the correct amount. Do not use a regular household spoon. If you're taking this medication for constipation, make sure to drink a full glass of water, 8 ounces or 240 milliliters, with each dose. The dosage will depend on your medical condition and how you respond to treatment. It's important not to use this medication for an extended period of time, as it may lead to dependence on laxatives and ongoing constipation. Overuse can also result in diarrhea that doesn't stop, dehydration, and mineral imbalances. If you're using milk of magnesia for constipation, it may take 30 minutes to 6 hours to produce a bowel movement. If you don't experience a bowel movement or if you need to use this medication regularly for more than 1 week, be sure to consult your doctor. Additionally, if you experience rectal bleeding, it's important to seek medical attention. For stomach acid problems, do not take the maximum dose of this medication for more than 2 weeks unless directed by your doctor. If you suspect a serious medical problem, seek medical help right away. If you experience diarrhea that lasts or worsens, it's important to contact your doctor or pharmacist. If your doctor has prescribed milk of magnesia suspension, it's because they believe the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to seek medical attention if you experience symptoms of high magnesium levels such as muscle weakness, slow or irregular heartbeat, or mental/mood changes. Dehydration symptoms such as decreased urination, dizziness, extreme thirst, and very dry mouth should also be reported to your doctor. Additionally, you should contact your doctor if you experience stomach or abdominal pain, bloody stools, or rectal bleeding. While it's rare, a serious allergic reaction to this medication can occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects. As for the best time to take milk of magnesia suspension and the recommended daily dosage, it's important to follow your doctor's instructions. They will provide guidance based on your specific health needs and concerns. Before taking milk of magnesia suspension, let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, appendicitis or symptoms of appendicitis, such as stomach/abdominal pain, nausea/vomiting, are on a magnesium-restricted diet, or have experienced a sudden change in bowel habits that lasts for longer than 2 weeks. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using milk of magnesia suspension. Some medications, such as raltegravir and sodium polystyrene sulfonate, may interact with this drug. Additionally, magnesium hydroxide can decrease the absorption of other drugs, including dasatinib, atazanavir, gabapentin, digoxin, mycophenolate, phosphate supplements, tetracycline antibiotics, certain azole antifungals, and quinolone antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of milk of magnesia suspension. Be sure to consult with your doctor or pharmacist to determine how long you should wait between doses and to find a dosing schedule that will work with all your medications. If you or someone else has taken too much milk of magnesia and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, while Canadian residents can call their provincial poison control center. Symptoms of overdose may include severe or persistent diarrhea, muscle weakness, confusion, irregular heartbeat, decreased urination, and dizziness. It's crucial to seek medical help if you suspect an overdose. Make sure to keep up with all of your medical and lab appointments. It's important to make some lifestyle changes to help prevent or relieve constipation. This includes regular exercise and a diet with enough fiber-rich foods like bran, fresh fruits, and vegetables. Also, make sure to drink enough water. For heartburn and other stomach acid problems, consider stress reduction programs, quitting smoking, limiting alcohol, and making changes to your diet like avoiding caffeine and certain spices. If you're looking to make some lifestyle changes, it's a good idea to talk to your doctor or pharmacist to see what might benefit you. Milk of magnesia suspension, in its final dose form, is primarily used as an antacid to relieve heartburn, acid indigestion, and upset stomach. It is also used as a laxative to relieve occasional constipation. The usual recommended dose for adults and children 12 years and older is 2 to 4 tablespoons once a day, or as directed by a doctor. It is best to take milk of magnesia at bedtime or as directed by a doctor. Be sure to follow the dosing instructions on the label or as directed by your healthcare provider. When storing milk of magnesia suspension, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a safe place, away from the bathroom and out of reach of children and pets. When it comes to disposing of this product, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. When milk of magnesia suspension is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.